Birth and the concept of pregnancy and birth is overwhelming and mysterious. The baby needs the utmost gentleness and respect as the baby emerges into the world.
The number one thing we wanted to know is who was going to be our care provider.
I delivered you with no complications, no episiotomy, no tears, no nothing.
Did you have any fears?
When I think about birth, what comes to mind is screaming, but also people always saying that it's a beautiful thing. It's kind of scary, but everyone always says it's really amazing.
I don't find it or feel it so, I don't know, far away or weird. But I think there's people that want to give birth more than me.
The couple who's just found out that they're going to have a baby are feeling some anxiety about where she's going to give birth, how she's going to give birth.
I was also worrying maybe what if something goes wrong.
Everything would be fine, but the pain medicine they gave me made it so I couldn't push, so they ended up having to cut me and use a vacuum to get him out. They also broke my water so early that I got an infection.
I don't like to generalize, but in some traditional practices, women aren't given the choice to make informed decisions.
I don't mean to scare you. Sometimes the needles and things, they're necessary. Just be sure that whatever they do to you in childbirth makes sense.
A midwife is constantly assessing the mother's hydration status or her blood pressure or her sugar levels.
We learn how to do all the complicated scenarios such as postpartum hemorrhage, shoulder dystocia is one of them, arrest of labor,
resuscitating the newborn if necessary.
And we are able to give women medication should they need it, or even call the anesthesiologist to give an epidural.
Midwives write prescriptions, are licensed, and predominantly in the U.S., midwives practice in the hospital.
A midwife has a relationship with an obstetrician, so when she sees a situation needing more specialized care, then she calls the physician, and together they develop a plan that's best for the woman and her baby.
I think that the midwife is with you throughout the process of your pregnancy, your labor, and your birth, and afterwards.
Well, I don't know about other people, but I was completely unaware of what it would do. But once she was born, the minute she was born, my whole emotional status changed. It was like the most amazing thing that ever happened to me.
You see them being born and they're born as them, as their personalities. I think you're born into this world as somebody at that very second.
Caring for someone is not just about making sure their blood pressure is normal and the baby's growing. It's about really caring for them, listening to them. And we can't promise them everything that they want. They may want a water birth, but if the fetal heart rate is not great, she can't have a water birth. But we can promise them that we can listen to them.